How many tablets will the nurse give per dose? What's the order? You have to administer 200 milligram PO divided the amount that you have available, which is what you have on hand, is 25 milligram tablet. How many tablets that you have to give? Tablet is there. This is where you're going. If tablet is where you're going, tablet will be in the numerator. Where do I find the tablet information? It's right here. That's what we have on hand here. Available 25 milligram tablet. Per one tablet, you got 25 milligram of that medication in it. Times, what do you have on hand? 200 milligram. 200 milligram, 1 milligram cancel out milligram until you have left tablet. It's 200. 25 times 1 is 25. 200 divided by 25 gives you what? 8 tablets. Are we done?
No.
What's left to do?
Every 12 hours.
Every 12 hours. A day has 24 hours divided by 2. That means that we have to give medication twice a day. 8 tablets divided by 2. The answer will be 4 tablets per dose. The nurse will administer medication X 25 milligram every 4 hours. The amount supply of medication X is 12.5 milligram per 5 ml. How many ml would the nurse give? Same thing. You have to administer 25 milligram every 4 hours. This is your order. The amount supplied, what you have available, is 12.5 ml. This is what you have on hand. What are you looking for? We're looking for ml. This is where you're going. This is what they're asking you to do. Do you need to do any conversion? Do you need any equivalent? No. Milliliter is where I'm going. If milliliter is where I'm going, then milliliter would be in the numerator. Where do I find the milliliter information? It tells you for every 5 ml, you got 12.5 milligram in it. What is your order? Your order to give 25 milligram, right? Milligram cancel out milligram till you have left milliliter, which is exactly what you're looking for. If you times 5 times 25 and then 12.5 times 1 and you divide everything out, it will give you 10 milliliter. You have to give 10 milliliter.